Alrighty, today we are going to be talking about Parkinson's disease, and hopefully all of you guys have seen this movie. If not, I highly recommend it. It probably is one of my favorite movies, and probably because it has Michael J. Fox in it. Michael J. Fox is one of the most well-known people that has been diagnosed with Parkinson's disease. He was, however, diagnosed when he was 29 years old, which is extremely young. Most of the time, people are not diagnosed with Parkinson's until around 60. So you'll mainly see Parkinson's in the elderly population. But because he was diagnosed so young, he was able to fund a research called Michael J. Fox Foundation for Parkinson's research. Okay, so Parkinson's disease is a age-related, neurodegenerative, progressive disease that mainly affects movement. It is the second most common brain disease secondary to Alzheimer's. And according to our Red Pathology book, it affects over 800,000 Americans. The biggest risk factor for Parkinson's disease is your age. So like I said, Parkinson's typically develops after the age of 60, so you'll typically see it in your elderly patients and adults. A couple of the hallmark signs and symptoms of Parkinson's disease are the rigidity, the resting tremors, the hunched over, stooped posture when walking, and then an overall bradykinesia, which is just a slowness of movement. One of those tremors is typically called pill rolling, and it's where you take your thumb and your forefinger, or even your pointer finger, and you just go back and forth like this, resting. A lot of the times, tremors can also manifest themselves towards the end of movement. So they may be handing someone a glass of water, and they'll be completely fine through the whole entire motion of it until they get to the very end, and then they start getting those shaking tremors. A couple of the other symptoms that don't include motor can be agnosia, which is the loss of smell. You can have drooling or restless leg syndrome, which normally happens at night. And then some other intellectual decline like dementia and then depression due to the lack of dopamine. And they typically can have like a mask-like facial expression. So a little bit of anatomy behind Parkinson's disease is that in our brain we have something called the midbrain, and then within that midbrain we have something called the basal ganglia, and that helps to control the motor function and executive functions. And within the basal ganglia we have something called the substantia nigra, and that houses the neurotransmitter dopamine. Now, dopamine is crucial for, again, that motor function, the executive function, and cognitive, and for also that emotional limbic system. And what happens in Parkinson's disease is those neurons that create dopamine begin to die and deteriorate, leading to a lack of dopamine, which then leads to a lack of movement control. And it also helps to explain why people with Parkinson's disease tend to also have depression as well because of that lack of dopamine. So there is no known origin for Parkinson's disease. A lot of doctors think it may be genetic or due to environmental exposure, like being exposed to toxins. So treatment, the biggest thing with treatment is to focus on managing symptoms and then improving quality of life. The biggest treatment is either medication or there's something called a deep brain stimulator. So the most common medication is called levodopa, and it's a sort of precursor to dopamine in the brain, and it sort of acts as a replacement to dopamine. So patients are able to take it, and it mimics dopamine in the brain. Another surgical procedure is called the deep brain stimulator, and it sort of acts as a pacemaker in the sense that, so the deep brain stimulator is in the brain, and it mainly helps with movement dysfunction. So say a patient is experiencing tremors. The deep brain stimulator senses those irregular electrical signals, and then it's in the patient's control, so they're able to hit it, and then the deep brain stimulator interrupts those signals to help stop the tremors. Of course, another option is physical therapy, and physical therapy is great for overall helping the patient be able to do their activities of daily living. Since Parkinson's does diminish so much of their movement, it is really important to get their strength training back in, their flexibility, their range of motion, focusing on their gait and proper gait function, endurance with that as well. And of course, just overall functionality is really good. And Parkinson's actually has its very own segment of physical therapy treatment. It's something that was created originally, so LSVT big. So LSVT stands for Lee Silverman Voice Treatment. So originally it was created for speech therapists to help people with Parkinson's be able to speak better. But they branched out and they created one for physical therapists. And it mainly focuses on making big, exaggerated movements like high knees, arm swings, anything that can teach the patient where they are in the sense of that they're able to still move. So instead of having hypokinesia, which is the slow, shuffling, lack of movement, it helps teach them like, hey, it's okay to raise your arm, or it's okay to take a big step. That's all normal. So that is what LSVT big stands for. And I think that is it. Thank you so much for watching my video.